All right. Good afternoon and welcome to the Health and Government Operations Committee. We have a lot of concurrences which are bill that we have passed, but there's some disagreement, no meeting of the minds, there's some changes, and we need to figure that out. It needs to go to the floor. We just got off the floor. We've been on the floor since 11 o'clock. We have to go back at 3:45. Many of us have not eaten, and I want to give you a minute to eat. So we're going to go through these, okay? House Bill 1474, licensed professional counselors, telehealth, students enroll in institutional higher education. The amendments establish a temporary telehealth license to be issued by the Board of Professional Counselors and Therapists. The board may issue the license to an individual licensed in another state for the purpose of providing counseling via telehealth to an out-of-state student attending an institution of higher education in Maryland, but only if the counselor and the student have had a previously established therapeutic relationship that existed for 6 months. The board is authorized to establish additional qualifications for the license and require to adopt certain regulations. This is important because some of our students need to continue that counseling, right? And we don't allow it now. This would allow them to do it for at least 6 months. Any questions or concerns about this concurrence? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, it's unanimous. The second one is House Bill 813, Maryland Insurance Administration and Maryland Department of Health Work Group to study pharmacy benefit managers. The amendment adds representative to the work group. It requires the Maryland Insurance Administration and the Maryland Department of Health to consult with the Prescription Drug Affordability Board and add additional items to the work group to consider. No substantive change, just adding more people and some additional items. Any questions or concerns? Seeing none, may I have a motion, please? Second. It's been moved in second. All those in favor say aye. Aye. Any opposition? Seeing none, it passes. Did I move this one? Yes. Okay. House Bill 699. General Provisions, Veterans Benefits, Honorable Discharge. The amendment confirms House Bill 699 to Senate Bill 491 as passed by the Health and Government Operations Committee by altering the definitions of honorable discharge to include a discharge that is less than honorable if the Department of Veterans and Military Family determine an individual is eligible for state benefit based on the federal criteria. Senate Bill 999 had this worded. So it's basically to make them conform. So are there any questions? It's been moved in second. Any questions or concerns? All those in favor say aye. Aye. Any opposition? Seeing none, House Bill 376. The amendment conforms House Bill 376 to Senate Bill 294 as it passed the House 135-0 by altering the membership and duties of the Maryland Cybersecurity Council. Is there a motion? It's been moved in second. Any questions or concerns on the concurrence? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, House Bill 384. Basically, the amendment adds on October 1st, 2025, the effective date to the bill to enforce the requirement that the Maryland Department of Defense certified disability certified to DLS whether or not the Maryland Department of Disability has sufficient staff to administer the program. Second. It's been moved in second to concur. Any questions or concern? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none. The House Bill 1510, the amendment provides that if notice is provided by email and no response from the email is provided, the healthcare provider shall provide notice by mail at least 10 days before the date on which the record is to be destroyed. So this is just a minor change. I did speak to PP, who has it, and he's fine with that, and so is Mekai. Is there a motion? Okay, it's been moved in second. Any questions or concerns from anyone? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, it passes. House Bill 1104, the amendments require the Department of Health to make a draft of the annual report available for public comment for 30 days. It required the Department of Health to provide a summary of the extent to which public comments inform the work of the department and the HSCRC. and it requires the department and the HSCRC to meet with certain members of the General Assembly on a monthly basis through December 2026, and sunsets the assessment on the hospital after 2 years and 6 months. I have spoken with the department this weekend. I also spoke to the HSCRC this weekend, and they are all right with the amendment. Is there a question? Any concerns? No. Seeing none, may I have a motion, please? It's been moved and seconded. All those in favor say aye. Aye. Any opposition? Seeing none, the concurrence passes unanimous. Is there anything else? Do we have Mary Lehman's bill?
You did it.
Oh, I did? Excuse me? Oh, 773, okay. I don't have that. It says receipt. Is there an update on that one?
No, I've tried to reach him. I haven't been able to reach him yet.
Okay. This is Senate Bill 773.
I didn't know we had it.
Yeah, no, but you know what? It's good that it came up because we're still waiting.
Right.
And we do want to get that bill through, and the vice chair has been working really hard on it. So can I ask you, Vice Chair, will you be so kind and call the committee staff over there and see if they can get a hold of him?
Okay.
Thank you so much. And thank you for bringing it up. It's an important bill for our constituents. Are there any questions from any of you or any concerns? Everybody's doing okay? It is sine die. We're almost done. Okay? And you should feel really proud of the work that you have done. You've done a lot of good work, even though we dealt with the budget, we balanced it, but we did a lot of great policy work in this committee, right? And the LAs are gonna finish the end of session letter, and you'll be able to go home. And I want to go briefly, if I may, 1 second, guys. If I may, I want to go over some things that I think you can go home and be very proud of. And that is the telehealth bill. It is now permanent in Maryland, right? It is the subsidy for young adults. It is the bill that says that if the federal government allows the tax incentives to expire in December for so many people that are receiving them, that we will have our own program, right? And we use reinsurance money for that. And that is the purpose of that fund, right? You have the AHEAD model as well, which is important for Maryland and our healthcare moving forward. We have the overstayed, pediatric overstayed as well. Those kids that are in those hospitals, right? And the kids that are in the hotels. We passed that bill. And we worked on so many other, the pharmaceutical, the prescription affordability board as well.
And also the adverse decision.
Right. As well. Like, you should be extremely proud of our work, and we could not have done it if we didn't work together, and if we didn't have the 3 OLAs we have and the staff that we have to keep us focused. I feel very proud of the work that this committee did. If you notice on the floor, most of our stuff is done. All right, we have a few things that are pending, but we did it together, okay? And you should be extremely proud of that. It was really worth the pain, the not sleeping, whatever it is you didn't do. Okay, it was worth it. Delegate, I know I had Taveras and then Chisholm.
I just want to recognize, where are they? Well, okay, here they go. My staff, Jason, Miriam Ali, and Stephanie Guerrera and her family that she brought them. This is the first time they're probably seeing the process of Bill. And I know we can't really say, I don't want to take up time on the floor, so I just wanted to recognize. Quería reconocerlos a ustedes. Gracias por dejarnos a Stephanie Guerrera para trabajar con nosotros. Y lo estoy explicando que esta es su primera vez viendo el proceso legislativo. Gracias por su trabajo.
Bienvenido. Delegate Chisholm.
Just quick, when we send out the end of session letter, who does that go to? I know that when we do it as delegates, it's the people that have contacted us, but when the committee does it just go to us, or who does it go out to?
The committee sends it to us, and we're free to send it to our colleagues in other committees.
I just don't want to double pay.
as well. And I want to thank them because that's a lot of work that they will be able to do that. So they stay pretty busy even when we're done reviewing a lot of the bills and all of that for months as well. I also want to thank our partners, all the different agencies that work with us. They came and testified, they helped us through the bills, all the different advocates that came, people that came and testified. I will say that this was one of the toughest sessions I have had, but it's one of the ones that I'm the most proud of because of the work that we did for the people in Maryland. Delegate Ross, I want to welcome you again to the committee. It was great having you. You came almost at the end, but you learn. It's like, what is it they say? You either swim or you sink, and you swim. Thank you. And Michelle and Andrea, thank you for everything you do for us, okay? You guys put up with a lot. You leave here very late, and what people don't see is the many times that we are on the phone on the weekend, you know, and how at 2, 3 in the morning you're answering emails, and I am just really, really grateful you do that. So I thank you for doing that. I want to thank the staff, Kat and Marcos and Maria, who's probably listening as well. And Trooper Kim, thank you very much for keeping us safe. All the interns that work with us, Andy and where are the other ones? The other ones are in the back. They work so hard for the HGO committee. I want to thank you for just being part of our family and for having such a great disposition regardless of what else was going out there. You have some time to eat. Please go and eat. It is 2:57. Take us down, please. Yes, 1 minute.
I just wanted to recognize the newest member of the Anne Arundel Central Committee, who happens to be my soror, Kelly Smith, and the president of the Annapolis chapter of Sigma Gamma Rho.
Welcome. All right. See you soon. Bye-bye.